If you've been on Instagram or TikTok lately, the odds are that you have heard about Ozempic, semaglutide. It's been on the news, several celebrities have been on it, the New York Times wrote about it. This is not surprising when you consider that nearly 1 in 3 people in the United States are overweight. Many people are determined to achieve a healthier weight. This is where drugs like Ozempic come in. But what is the impact on mental health? In case you're not aware, Ozempic is a medication that was FDA approved for the treatment of type 2 diabetes to help control blood sugars. Because of the added effect of weight loss, many people started using this medication off label to help them lose weight. So the pharmaceutical company took the same ingredient in Ozempic, called semaglutide, increased the dose, and repackaged it as Wegovy. This was approved as a weight loss medication for adults with obesity or overweight with at least one weight-related condition like high blood pressure, type 2 diabetes, or high cholesterol. And it works, especially when combined with a reduced calorie diet and increased physical activity. This is why there was so much buzz on social media and television about the effects of this medication on weight loss. This frenzy increased the number of people reaching out to their doctors to prescribe semaglutide to help them lose weight. This reminds me of Amy, a stay-at-home mom I saw in the clinic a few months ago. She was once a gymnast but had become about 75 pounds overweight. So you can imagine the frustration she experienced as she struggled to get her weight down to normal. She had 2 young kids and talked about huffing and puffing to keep up with them. She also said her weight was affecting her relationship with her husband. She stopped going out as much because she disliked how she looked. She was no longer the bright, cheerful person she used to be. So she decided to try Ozempic. This medication reduces blood sugar levels and delays emptying food from the stomach, keeping people full for longer periods. It also acts on hunger centers in the brain, decreasing food cravings. Amy lost significant weight in a few months, but there was a problem. She was feeling depressed and anxious. A recent article from Forbes shows that many people have complained about anxiety, depression, and suicidal thoughts with semaglutide. Is this a coincidence? Is it possible that people who develop feelings of anxiety and depression would have developed them by pure chance without the biological effect of the drug? Another plausible scenario could be that people developing mental side effects from semaglutide have a higher likelihood of having mental health issues. In Amy's case, she noticed she was feeling down with crying spells, difficulty sleeping, fatigue, poor concentration, and lack of pleasure. She was also feeling very restless and irritable and had a lot of muscle tension. This went on for several months. We started Amy on an antidepressant and therapy. She also later decided to stop Ozempic because she was worried it was affecting her mental health. Between starting treatment and stopping Ozempic, it's hard to say what worked, but she felt better. Now, if you check out the labels, Wegovy lists adverse mental health side effects, but Ozempic does not. Both drugs contain semaglutide, which, according to Wegovy's warning label, could raise the risk of anxiety, depression, and suicidal ideation and attempts. But why are these mental health effects not listed on the Ozempic label? It's not that the FDA or drug companies are lying or hiding stuff. It just happens that the original Ozempic clinical trials did not study the effects on mental health. Also, the amount of semaglutide in Wegovy is higher than in Ozempic. On the flip side, some reports show that Ozempic and Wegovy can help squash depression and anxiety. Health experts agree that these medications may impact mood via brain changes, but the likelier reason for the reduced depression and anxiety is the positive mental and physical health effects of weight loss. Losing weight can improve self-esteem and overall mood, leading to a more positive outlook. The confidence boost that comes with achieving weight loss goals can be transformative, decreasing feelings of depression and improving mental well-being. Whether you're on Wegovy or Ozempic, if you notice changes in your mental health, you should talk to your doctor.